Welcome to the Conception Channel podcast.
Hello, everybody. Welcome to the Conception Channel podcast. I am your host, Spence Pentland. And today we are here with Holly Yeager. Holly is a clinical counselor specializing in reproductive conditions, pelvic pain, pregnancy loss, but we'll get all into that very soon. But first, welcome, Holly, and thanks for coming on the show today.
Well, thank you for having me, Spence. It's good to be
Excellent.
here.
Yeah, you're just saying we'll get going, quickly. And if your voice is starting to fail, let me know. I know you're up. You said in the Okanagan in Canada here right now, there's a lot of forest fires and a lot of smoke and so just let me know. But we'll hop right in. But before we do, I know everyone's going to be interested to kind of hear what you do and, the typical processes and emotions and advice and all kinds of things. Because the mental emotional piece of reproductive or infertility and pelvic pain and third-party reproduction, all these things is a huge piece of what happens. But can you give everyone a bit of a background on yourself, where you've been and 15 years of practice later, here you are now.
Yeah, exactly. Well, actually, I was just doing the math and it's actually 20 years. I guess I haven't updated my website accordingly.
You didn't go to school for math. That's okay.
Yeah. Well, yeah, then it sort of shows everyone how old I am. But yeah, I've been a counselor for 20 years and always focused on reproductive health.
Mm-hmm.
So whether that, is infertility, pregnancy loss, postpartum. And so for the last about 14, 15 years, it's been strictly reproductive health and fertility.
Right.
And for about the last 10 years, also adding in third-party reproduction for people going through donation and surrogacy. So that sometimes also involves infertility, but often not. Well, sometimes it does, sometimes it doesn't.
Right.
So yes, and you mentioned pelvic pain, predominantly like chronic pelvic pain, endometriosis. So yeah, that's kind of the gist of the people I see, the topics that we cover.
Yeah. Well, we've known each other for, I don't want to count anymore, a long time. And so that's good for clinical experience. But again, like you said, showing our age, but that's okay. Anyway, so maybe we could kind of, as a way of structuring this moving forward, we could maybe touch on some of those things you just listed out, and then, kind of what's typical or common within each of those, just so everyone listening has gets something out of this and has somewhat of an idea of what to kind of expect or what advice they might get. But does that sound like a plan for moving forward? Okay, great.
Sure.
Is there anywhere you said, let's just start in general with fertility, and kind of maybe there's a bit of a natural hierarchy here, but just with fertility in general, I mean, what people do you work with? Is it mostly women, or is it sometimes male partners too, or?
I would say the majority, probably 75% of my clients are women, and sometimes they bring their partners, male, female, non-binary, but mostly women are the ones who are, I find, accessing counseling.
Right.
And sometimes they bring along their loved ones.
So does this, obviously there's must be a natural integration of relationship and some sexual health counseling as well, or is it really just kind of surrounding fertility, or what kind of things are talked about and covered, and do people come to you? Yeah.
there's a few things. I mean, anything can come up. I find that fertility, reproductive health is connected to pretty much everything
Yeah, yeah,
in
yeah,
life, as
true,
you
true.
probably know too. And
Yeah.
so sometimes anything can come up, but I would say the themes, like the predominant themes, are grief and loss.
Okay.
So even when IVF is successful, there's still an element of loss to process.
Hmm. Hmm.
That it's not didn't happen the way, you know, that was expected or hoped.
Right, right, right.
Loss
Yeah,
of kind of the dream of how it was going to look.
right. Okay. Even before someone goes into an IVF, or during or after, for
Yeah,
sure, I get.
yeah, good question. It's I would say before, during, and after.
Yeah. Okay.
So even when the dream is there, even when the baby's in their lap, there can still be, a feeling of being robbed of
Really? Hey.
a
Okay.
spontaneous, innocent, easy way of having a child.
Right.
And certainly at the beginning stages, when trying to conceive, whether, their partner at home or at a clinic, that's definitely a theme that comes up, is just
Yeah.
trying to get used to that idea of it looking different.
Right.
And then during treatment, because there's that loss, but also, if a cycle doesn't go well, or if there aren't, as many embryos as expected, the loss of time, money, energy,
Right. Right.
loss of maybe giving up other opportunities, like for promotions at work, to focus on this,
Right.
just
Right.
on and on, for long.
Yeah. That's that I believe that, and that's huge. So it starts kind of with, well, what the hell, I've spent my whole life desperately trying to not get pregnant,
Yeah,
and then, when I decide to, it's been such a challenge, and now I'm facing IVF. Like that's a lot that goes on in a relatively short period of time in someone's life, and so the mental emotional
exactly.
burden is quite large. Hey.
Yeah, exactly. Yeah, you must hear it all the time too. It definitely is a big piece of it.
Of course, of
And
course.
then loss of relationships, and just
Mm.
feeling isolated from other people, and
Uh,
other family events where there's lots of kids, and that kind
right.
of thing.
That those first year birthday parties or baby announcements, or,
Yeah,
I see that all over, social media and stuff these days. It seems a very typical thread that people are trying to educate others on, how to be with someone that, that when you're around someone that may be struggling, with fertility in one way, shape, or form or another, what to say and what not to say. It's a complicated time, because so many things can be triggering, and even, I never even thought of what you brought up about, after someone's been successful in an IVF, that they still have a process that they go through.
yeah, especially when they're meeting other moms in their kid groups, and
Ah,
they're talking about, oh, can you believe we're on our third kid and we weren't even trying, and
oh,
and
yes.
they're like, how long it took me to get one?
Got
That
it.
kind of
Yeah.
thing. It doesn't end, unfortunately. It gets
Yeah.
easier, but
Yeah.
it doesn't go away completely.
Right. Right. Okay. So, and are there, and we don't have to get too deep into it, but there's, in my experience, there's cultural differences too. Some cultures have a little bit more pressure from family to conceive. And do you end up seeing some of that, where people just kind of have to work through, extended family pressures and.
Yeah, I would say, I look at each family is a culture in and of itself sometimes.
Yeah, yeah, okay, yeah, of course.
And so each family has its own kind of ideas of how things should be, but certainly within a larger community,
Yeah.
there are values placed on, maybe more strongly in some cultures than others, on having grandkids, and
Yeah,
and then
yeah.
in some cultures it's also, there's religious beliefs involved, and
Right.
about maybe against IVF, or so a lot of people find themselves not feeling like they can't share with their family about their struggles or about what they're doing to try to,
Right.
have a child.
Yeah.
So it's kind of shrouded in secrecy a lot, particularly if there is donation involved.
Right.
That's kind of a whole other level sometimes.
Okay.
But I am seeing more and more people being open compared to when I first started doing this type of counseling.
Yeah.
So I think that's a positive.
Yeah. And more there, I agree. I've seen that too. And I don't go deep like you do at all, but I hear, in the clinic, and even, the acceptance since you and I started, and how IVF has kind of come from, most people not even knowing what it is per se, to it being, quite a socially accepted option as soon as you're trying to have a baby.
Yeah, it's interesting. There was a time not long ago where, exactly, people didn't even know what IVF was. And now I'm sure you have the same thing. We can meet with a client and they can tell us all about the different protocols that are out there before they've even started their IVF. So it's
absolutely
come a long way, but talking about it openly there's still room for improvement, I think. Wish that stigma wasn't there, but
so any just on that topic, anything in particular that you're seeing, and that you kind of have thoughts on for people listening? Because I used to, people used to always think, well, IVF isn't natural and I don't want to do that, and that's not my first choice. And I encourage people to stay open to how baby comes to them, but also it being natural or not, kind of is whether or not you're looking at humans as being separate from the natural order or not. I mean, there's a lot there, but I think that once someone gets into IVF, for people listening that aren't really sure of what, if that's a choice or if that's something they would want to do or not. But I mean, there's still a large part of that is a natural process. And, the ultimate decision, isn't made, at the IVF center of whether or not that embryo becomes a baby, right?
Right. You're right. Exactly. There's so many variables that play a part in a little embryo surviving and thriving. And
right.
I mean,
so there's still a huge natural order, playing a role there. And, the IVF doctors are amazing, and the embryologists and the labs, and they do what they can to get, a lot of people over certain hurdles and challenges. But ultimately there's
they can't do everything though. And what accounts for the rest of it, we don't know. You can have everything in place and it not work out, and you can have everything in place that does work out. I think that's another theme, actually, is the uncertainty involved in all of this. But just to go back to your question, is I don't know. I respect people's wishes. There's lots of reasons for not wanting to do IVF. Some people have needle phobias.
Right.
Some just find it more invasive. Some it's just not financially feasible for them.
That's a big one. Yeah. Mm-hmm.
Big one, definitely. And then, sometimes it's misinformation, I guess, of what it's going to be like. So I think it is good to respect someone's wishes, but also, if they're open to it, explore why. Because if it is a needle phobia or fear of the medications or something, sometimes just talking about it can open up all new possibilities. I think what I've noticed over the years is a lot of people are very fearful of what those injections are going to make them feel like.
Right.
But what I hear afterwards, almost everybody says it was easier. Well, not the process was easier, but the medications went better than they thought.
Right.
And almost everyone says, I wish I had started sooner.
Oh, yeah. And that is there's just fertility in general, always starting sooner is always the the theme, but
Sure.
and where there's always going to be success. So the question is, when should I do my IVF? And it's like always sooner is statistically better, but you need to be ready too in different ways. But
yeah, and unfortunately society doesn't really go along with that, in terms of when we're ready, career-wise and stability and home and partner and all of that stuff. So, those things haven't matched up completely yet.
So is there, we're kind of still on the fertility and tying in the ART or the IVF and these assisted treatments. Is there common emotions that or some sort of process that is been established or that you see that people go through, or is there more anger or sadness, or is it a combination of everything? Or
yeah, I would say, I mentioned grief and loss, and there are a lot of emotions that go along with that, and anger is one of them for sure, for most people. So yeah, going with I guess the stages of grief, at first it's like, what do you mean this isn't going to come easy? And what do you mean I have to have some intervention? And so that disbelief at first, and then anger, and sometimes more of, heavy grieving, sadness.
Right.
But I think one of the themes kind of related to that, but different, is the uncertainty involved.
Uncertainty.
I think we're kind of conditioned in life to set goals, do what we need to do to achieve it, and move on to the next. And with fertility stuff, it's not that simple.
Yeah.
If it were, we wouldn't need fertility clinics.
Yeah.
And I think that's a hard one because it's not something we're wired for. Just the not knowing how and when, and is this the cycle that's going to do it, or is it going to be next cycle? Will it be any cycle? All of those questions can come up.
Well, like what you touched on there is something that I've felt and seen and have talked to so many, people about. Is, okay, we've been brought up, maybe the past few generations, especially maybe women or people who identify as women, that I can, everything from become a doctor to vote to, where I'm going back to in history. And so if I just put my mind to it and drive forward, I will accomplish anything I want now. Conception is a tricky one in a sense, because it's not always just about setting your goals and accomplishing them. There's more to it.
Yeah, exactly. It's goals are part of it, but it's not the same as goal setting for other, for achieving a career goal or a fitness goal or something like that. There's a lot more to it for sure, like you said.
Right. It's often in clinic, and yours is much more complicated. I have to keep, the mental emotional piece a little more simple because there's other things we're going through, and it's not my expertise, but especially for, a lot of women there's just so much that goes on, and then you start thinking about IVF, and there's so much, and then there's usually at a point in a career where there's a lot going on there too, and there could be family things and all. Like, life is a lot in the 30s and 40s, and it starts really ramping up, and
it all collides.
This conception is more about reception in some senses, and kind of opening up to that possibility and letting some things go and surrendering, but persevering. It's all kinds of pushes and pulls. So is there, some basic, advice you give to people that are caught up in that. I guess overwhelm would be a good word, maybe.
Mm-hmm. Yeah, we usually, when feeling overwhelmed, we usually focus on finding ways to feel some, I'm not going to use the word control, because I really work with people to try to be okay with the feeling of not having control.
Okay,
because
yeah.
that's largely what this is all about. We can't control which cycle it's going to work. We can't control whether it's going to be IVF, IUI, whether it's going to happen at home.
Yeah.
We can do everything we can to make that, a possibility, but in the end, we can't control the
Right.
exactly how it's going to look from moment to moment. And so working on that, which is related to uncertainty and just being okay with finding a way to be okay with that feeling.
Right. Trying to surrender somehow. It's easier said than done, that's for sure. Yeah.
Yeah. Like knowing that you're doing everything you can, being open to the possibility that things will work out, but being okay with not knowing exactly how that's going to look.
Yeah. Yeah.
So that's a big part of it. And then for feeling overwhelmed, there's a few things that we work on. It's different coping strategies, I guess, making sure that someone feels like they have that sense of, again, I don't like the word control, but
in certain areas of life, control what you can, kind of, or
yeah, I guess that's it.
Yeah.
Some autonomy and just ability to get through different times, different scenarios, different tools to use. Basically, I think that can increase someone's sense of confidence, and that helps get through a lot. Particularly at a time where maybe they're not talking about it too much, don't have a lot of support in other areas.
And I think that's where we might really, correlate, our different practices, because it's like, okay, well, you can try and control diet or your exercise or your sleep or taking some supplements, some things that give you faith that you're taking care of a few things that you can.
Yeah.
Right.
Yeah,
and you can do that mentally, emotionally as well.
Yeah, absolutely.
Yeah.
Covering all your bases, kind of not just the supplements and things that you're taking, but what thoughts are you allowing to take over, and what are you doing with strong emotions that come up, and where can you go for support, and what can you do to kind of get through tough times?
So there would be, that common theme, like you said, I see, or my friends are getting pregnant, or someone at work, or I've been getting, invited to baby showers or first year birthday parties. What kind of, do you give people permission to just spiritually divorce pieces of their life for the time being? Or I don't know, maybe not a great way of putting it, but what kind of
I've heard that term, but yeah, absolutely, I do. I think if the tables were turned, and I've lost track of how many people I've spoken to who are planning, not just going, but planning a baby shower for a friend while they're trying, while their heart is broken after having a miscarriage, or trying with IVF or whatever. And I mean, come on, there's limits. And if the tables were turned, I bet they would be perfectly understanding if their friend had to cancel or change plans. And so I go over that and try to remind them that we're human, we're not perfect. I do caution, though, that if you're, I think, yes, give yourself permission to avoid things that are triggering. But also, sometimes it can't hurt to explain maybe why they're withdrawing from certain things, because if you just kind of check out of life, and people will go, do they not like me anymore? And what's going on? And so but again, that can be a cultural thing too, where it's just doesn't feel safe to share, but
that can create other problems, or
exactly.
right, I guess. Oh, that
kind of going over that. That's part of the tools or the strategies, figuring out a game plan for that, those kinds of scenarios.
Yeah, because not to generalize, but you know, a large portion of, you know, these women that want to be mothers are this caretaker is built in to a certain degree, and to stop taking care of their, you know, best friend and their baby, or so it's hardwired, and so undoing some of that, because it is really impacting them, is probably very important sometimes, but a big process, I don't doubt.
Yeah, for sure. And yeah, you're right. I think for women in general, we're kind of socialized to be helpers and caregivers. And so it can be hard to say no and to look out for your own needs when necessary. But yeah, I think, you know, giving permission to skip things is really important, and or at least giving permission to consider skipping it. They might still choose to do it, and you know, after weighing the pros and cons, if that is the best option, great. But just, you know, thinking about not doing things just automatically.
Okay. Switch gears just a little bit here. Something I've never, I've got some of my own ideas, and I try to just mostly listen when I, you know, I've use Hakomi or some of the things that I've learned. But when someone has had termination or an abortion in the past due to various reasons, it not being the right time or the right person or whatever, that must be something that lands in your lap often, because it's it's the place where people would feel safe to download that. Is there, you know, is there any, I don't know, is there anything that you have found that brings comfort to people, you know, especially if they after that have trouble conceiving? You know, the emotions they have can be quite profound, I'm sure.
Oh yeah, the blame and guilt. Big. You know, I think what I try to do is normalize it. You know, it depending on the stats you read, it's 20 to 40% of women will have at least one abortion in their lifetime.
Okay.
And it's not because of a personal failing. It's often because of failing of the birth control they're on, or just not ideal circumstances. And at the root of that is a choice rooted in wanting to do what's best for. Some people say it's a choice for themselves, but actually it's a choice for that unborn child, you know, to not want to bring a child into a situation that's not ideal. We all want what's best for, you know, that goes to expectations of what, you know, what it's supposed to look like. And everybody has that. And so just trying to normalize that, and applying on the self-compassion, because again, if a friend shared their story with them, they probably understand completely, but it's a lot easier to criticize ourselves. And then, sorry.
No, I love that, Holly. You keep coming back to that, to how would you be with your friend or your sister or your daughter, even if this happened to them? You'd be much more compassionate with them than you would be yourself, typically. I would
place a bet that they would be. Absolutely. But yeah, for ourselves, we're always our own worst enemies sometimes. And then, also along the lines of compassion is really, I think, it's really easy to have hindsight and say, oh, I should have done something different. I should have kept the pregnancy. But that's using a lens of today, where maybe the relationship, the finances, the career, the living situation is all different. And it's really easy to put that onto past decisions, when it's important to go back to what were the reasons back then. And then also sometimes some stats, as boring as they are good, because you know, we know that research has shown abortion affects fertility less than 1% of the time. So
Okay.
going
Oh,
back to
that's great.
that.
Yeah.
Yeah, sometimes
Uh,
knowing
I
that is good to know.
that's huge, and I didn't have that, but that is really great to know. So basically, it, in simplifying even further, is that it does not, it really doesn't, very rare. You could call
Yeah,
it very rare
it's
occasions. Yeah.
so rare. And if something were to come up from a termination, it would probably be at the time, like they would probably know about it at the time there would be a complication.
Yeah. Yeah.
Very
Well,
unlikely to just pop up 20 years later.
yeah. Yeah. I have a personal belief and take it or leave it, but it certainly seems to adhere and resonate with a lot of people that have had losses. And maybe this is a bit of a segue. I mean, because you keep coming back to the grief and loss, and this all, I guess you've found that root, and that makes a lot of sense to me. Because when Chantel and I were building our family at 7 pregnancies to have 3 wonderful little boys, it took us so, and I had a story shared with me early in those times. It was a long time ago, that I share now with patients that have had miscarriage or loss, or and it really helped me, so I like to share it. I've heard too many things similar since that it's a belief of mine now that is really, really solid, that even when there is a loss, it's the physical vessel, that spirit is still most often going to find its way back to you.
Yes, I love that. And there's some First Nations, I guess, beliefs
Yeah.
along those same lines.
Yeah.
And yeah, I absolutely love that.
Yeah. And that, I mean, there's usually myself and whoever I'm speaking with, that brings tears, but that is it. I believe it with my whole heart. And anyway, so there is that's important there. But I wanted to chat about third party, because that is something that you, like you said in your intro, in the last 10 years or so has become a major part of your practice, and because it's become a major part of choice for people.
Yeah, it's become so much, with the technology getting better, it's become so much more accessible.
So can you just kind of give people a Cole's notes of what we're talking about, third party, and what that is?
So third party is, I guess the official terminology of third party is the assistance of, and this is kind of a heterocentrist definition, because they're assuming people who are conceiving are in a couple. So
Okay.
it's the assistance of a third party who's providing their eggs or sperm or embryos or uterus to help.
Right.
And so it's not always third. Sometimes it's a fourth person or a second person or a whole combination of things.
Often the second person, in my experience. Yeah, a lot of women that have gone through career and just got to a point where it's like, I'm not finding the right person, and I'm not waiting for that. I want to be a mom or whatever, right? Yeah.
Absolutely. Which I think is fantastic.
Brave and awesome. Yeah. Mm-hmm.
Yeah, absolutely. And that's what I mean by it being more accessible, because we have choices, and even though it's expensive, it is a goal you can set, and for many people can achieve, to save up the money and get the resources, and so yes, absolutely, choice moms and some dads. And then also individuals or couples using donated eggs. That donor sperm has been around since the dawn of time in various forms, but donor eggs, the first time I saw someone going through donor egg was about 2009.
Right.
And it was a whole different process back then. But since then, it's, the way that they are able to freeze eggs and
Right.
egg banks, just like sperm banks, and it's a whole different.
Yeah, but it's for eggs. Well, not that long ago, egg we want to differentiate between egg freezing, which I think is quite popularized now, and people have a lot better understanding of that because of careers and just that choice that's maybe even in the last 5 years or so that's become really prevalent to women. But egg freezing and embryo freezing has happened for a long time now, but egg freezing is a much more challenging process, and in its preliminary stages, it wasn't even that long ago, was mostly just for cancer patients, from my understanding, people that were going to go through cancer treatment and wanted to make sure they could preserve their fertility, right?
Yeah, that was the aim at the beginning.
Yeah.
Not realizing that it could be used for so many other purposes.
Yeah.
And yeah, you're right. Like at first, I mean, yes, they've been freezing embryos since IVF existed in the 80s, but eggs, that they've gone through a few
challenging times, probably.
Yeah.
Yeah.
In how successful they are, or how usable they are after being frozen. And so that's, one of the things I hear a lot, you might also, is, oh, I wish I froze my eggs 20 years ago, or I wish I froze my eggs 10 years ago. And
you couldn't. Yeah. Mm-hmm.
Yeah, you really couldn't. It would have cost a fortune, and it probably wouldn't have worked at all.
Yeah.
And so it's really only been in the last decade where it's
the vitrification technology has advanced, right?
Yeah. But a lot of people aren't aware of that. So that again is sort of the regrets that I think if they have the education around that, they can
they're not. Exactly. That's why I want to bring it up too, because that's big, and the difference between the embryo and the egg, because I think there are misconceptions that it's just the same but different. It's much harder to freeze an egg than an embryo, from my understanding of the science and technology.
Much more fragile.
Okay, so within that, I mean, there's not using, what I hear people say a lot is, it's hard to, I want to use my own biology. I don't know where this terminology comes from, but I'm just reflecting what I hear in clinic. And that's a tough piece, to somehow it not to be, the sperm of the father, or the intended father, if there is one, or the egg of the mother, or what is there some more common kind of themes and emotions or processes that people might go through? Let's just, speaking of more the donation.
Okay.
Yeah,
that's a grieving process too.
Of course.
I don't think I've met anyone who just decides, okay, let's just switch to donor eggs or sperm overnight. I think it is a process to wrap your head around. And for some people for the people I talk to who are trying to decide whether that's the route for them, we have a discussion about, I think almost everyone, not everybody, but almost, their first choice is a genetic connection to their child. But then looking at, does that have to be there? And what is the most important thing? And most people that I talk to will say that the most important thing is the experience of parenting.
Being a parent,
the experiences they can provide to a child. They find that there's a lot of things that they can still pass down to a child who's not genetically connected. That would be a culture, again, traditions, all those kinds of things. And so for people who choose donation, that's usually the process that they go through. They get to that point where, and a lot of times too, I'll hear, well, I got to a point of where adoption seems like a good idea, but I like donation because I can carry the pregnancy. And so, but there are some who still say, no, it's just not right for me. And that's okay. I think as long as you're thinking it all through so that there aren't any regrets down the road.
Yeah. This is why when someone's there, I'm like, first thing you have to do is just speak to someone, go to Holly, and just because it's when you start unpacking it, there's going to be a lot, and I encourage people to not do that on their own, but and just someone like you can kind of give this overview of everything from emotions to process to financial, even in some senses, probably, and legal. I don't even know, in some ways, which is a whole other thing probably, but and maybe we'll touch on that in a second, but is encourage people to not just try and hear that word from their IVF doc, because it's thrown out sometimes pretty quickly.
Oh yeah.
And without much else, following, to talk to someone like Holly, that can help at least, put one foot in front of the other without that overwhelm anyway. So that,
because I think information, correct information can help with that feeling of overwhelm.
my goodness, that, yeah.
You mentioned about the idea of donation being put out fairly quickly. I think that's part of it too, because some people I talk to, they feel a little distrusting of it when it's kind of offered as a solution at the first appointment, but they're not seeing necessarily, it's easy to say, oh, well, the doctors are just trying to make money or something like that, but they're not seeing the other stuff that, the first time they've met with the doctor, they may already be in their 40s, and their a clinic is just, they just want you to get a baby, and they want you to do it as soon as possible.
Exactly.
That's their goal. They're not looking at the emotional part of a loss of genetic connection. They're just like, you want a baby? We can help you.
I can't speak to other cities, but where in Vancouver and my experience and being in the field for about the same amount of time as you, and knowing the IVF docs quite closely at almost every clinic. No one's thinking money first. I just, that's legit. They're there to practice medicine to the best of their capabilities to get you to your goal of baby first.
That's my impression too. Absolutely.
Yeah, I can speak to that, and I'm confident with that there. But I really quickly that it because it involves so much, like the cost and the emotions and the legal, like you said, and is the cost, how does the cost of because sometimes there's a couple different processes they can go through an IVF with a known donor or that kind of process, or there's also the banks now where they can you just kind of simply touch on a couple of the options that are out there, and like kind of the process or cost of those?
Well, if you know someone who's willing to donate their sperm or eggs, that can be a really good option. People who choose that, they do it mainly because they want to know an actual live person who's contributed, rather than a profile and a photo. And they also sometimes want that person to be involved in their child's life in some way, not as a parent, or even family, but accessible, I guess, to be able to pick up a phone and ask a question.
Well, auntie something, or that even just health concerns or something. Health
concerns, or like a close family friend, or like an auntie role or something like that. It just feels more cozy to them. So that can be a really good option. And then others who choose an egg bank or a sperm bank, they tend to do it because they don't know someone who's going to donate, or they want to keep it out of their family dynamics or friendships. They don't want to complicate things. Sometimes when you know someone who's your donor, the boundaries can get blurred.
Right.
And they want to just keep it clean, so they'll go to a sperm bank.
Yeah, that's
Yeah.
the legal piece is set out. It's much easier and simpler. And okay, got it.
Yeah, all the legal's done. The medical screening's done. It's quicker because all of that is already done for you.
Yeah.
There's a few different types of donors at sperm banks and egg banks now. So it's not just anonymous. You can also choose a donor who will be open to being contacted after your child's an adult.
Fantastic.
So there's different options now. And with someone you know who's donating, although it can be a really great option, it does slow the process down. And just because you know someone willing and able doesn't mean they're going to pass the medical screening. Or if they do, say for donor eggs, it could take several tries to get enough eggs. So all of that can add up and in time and money.
Yeah.
And so, and then yes, there's a legal agreement for if you're doing it with a known donor at a clinic.
Yeah.
There are some people who do known sperm donation at home without the help of a clinic, and that's a different topic. Similar but different. Yeah. Altogether.
Yeah.
So there's different options.
Lots of different options. Okay. And yeah, they all come with different thought processes, emotions, legal structuring. And I hate to keep bringing that up, but that's something that everyone, I assume at some point bumps into, just making sure things are done right?
Especially in the case of, I'm thinking of like a single woman whose male friend is going to donate sperm.
Right.
And it might not be so straightforward as to the role that sperm donor will play. Is he going to be strictly a donor?
Yeah.
Will he want to be a parent in the future?
Yeah.
Are they actually thinking more of co-parenting? So talking about all that from a psychosocial perspective is important, but then absolutely the legal.
Right. And again, why speaking with someone like you, because you can get really excited about something probably and sit and talk with a good friend and be like, oh, this is a great idea. But then when it comes down to, unpacking that and thinking about it the next morning kind of idea, there's a lot more to it that just isn't, wouldn't come to mind right away.
Yeah, because it's unfortunate where some women have gone into agreement like that, but their child was conceived through intercourse with someone they thought was going to be a donor who later wanted more of a role.
Yeah.
And with the law, they actually found that the donor was actually considered a parent with legal rights.
Yeah. Oh, yeah. Yeah.
That was not part of the bargain, at the beginning.
Yeah.
So it's
interesting. Yeah. Yeah. A lot of subtleties there that would be, again, call Holly. Cause I right now, everything counseling is all online anyway, right? With COVID and that's it's made, what you do much more accessible to people anyway, I think. And largely you don't need to sit in a room with someone. I assume there's some times where that's really beneficial, but often probably not necessary.
Yeah, I find, for things like trauma counseling, I think in person is still the better way. There's certain types of therapy also, excuse me, my voice, where being in person is essential. Yeah. But the type of counseling I do, I think video works better than I thought it would even. Yeah. And sure, there are some people with Zoom fatigue, but the feedback I get from most people is that they appreciate not having to commute. Yeah. They don't have to, pay for parking. They don't have to wear shoes.
Or pants. Yeah.
Well, ideally pants, but
I didn't mean you, Holly.
I wear pants, well, shorts, something.
Well, I have now a dear friend, but for many, many years I went through coaching, and it was it's all been over the phone, and that is just audio, not even video. And, so I can be in a comfy place in my bed, without pants, or however I want to be. I can ugly cry, I can whatever. And it's I feel like it's really safe for me that way too. So there'd be times where
Yeah.
I want to be with someone. That makes sense. But I also I like the different options. Yeah.
I think there's something to that, just being in the comfort of your own home.
Yeah.
That definitely provides a safety and
Yeah.
comfort.
Yeah. Yeah, that's great. So, well, on that, before we go, I wanted to chat about, how COVID maybe has shifted things quickly, and I am being cognizant of time here, but the epigenetic piece of carrying a pregnancy, like with the back to the third party donor route. I and I think science is really explaining and showing us that you do carry that pregnancy, whether that egg is yours or not. So much of who you are is going to be embedded in how the genetic code is expressing itself, that ultimately the child will be a lot like its its parent, its mother, its
Yeah.
parent. Is that not fact, or close to it? Or
Yeah, I mean, there's research out there showing that, and just anecdotally, I've seen that a lot. I don't know if you have also,
yeah,
where, because I love when people send baby pictures, or they meet with me
right,
a few years after, or postpartum, or a few years after the baby's born, just to kind of touch base and debrief, and
yeah,
and it's amazing how much the children are just like their mom,
yeah.
and regardless of a donor or not. And sure, granted, most people choose an egg donor that resembles the mom, but not always. That's not always possible.
Yeah.
I've seen couples where their egg donor was not even the same race.
Yeah.
And I think
Yeah.
there's a lot to be. How much of that is epigenetics? How much of that is learned behavior after the child's born? Who knows? But it's pretty fascinating.
Yeah,
pretty cool.
totally. Yeah, I love that piece, because that's kind of, without being a counselor again, that's kind of one of the bridges I use. I'm like, technically your influence, while carrying, is going to really determine a lot of how the genetics are going to express themselves, so that that child will be yours. And obviously I default to you again, and genetic counselors obviously are important at that point too, if you want to get deeper into that. But I just wanted to touch on that without going too deep, because the science gets complicated. But
because I look at it, parenthood in a few different ways. Like, technically it's a social role, being a parent.
Right.
And sometimes that role also coincides with genetics.
Yeah.
And then also with carrying a child, some people will say, well, if it's donor eggs, I'm not the biological mother. But I've heard terminology saying, yeah, you still are biological, maybe not genetic.
Yeah.
Connected, but biological
mother,
for sure.
Yeah, I like that distinction. Yeah.
So, yeah, and then there's legal parentage. So there's, the legal, the social, the genetic, and the biological. That's kind of how I look at it. I
and spiritual.
Yes, that's true too. Yeah.
Big time. You're gonna be Mama Bear. Oh, that's beautiful. I like that. And these are the ways that I think people ultimately, if they want a little one, that's they work through these things with you, and get to a point where it's like, let's do it. Let's move forward.
Yeah. Okay. Figuring out the best way to do that. And yeah.
Fantastic. Okay. Just quickly, COVID, has COVID done anything? Have you noticed any trends that with, on mental, emotional health, or anything that's going on that's been, well, okay, that's a big question. Or I don't know. Is there anything in general you wanted to throw in there for even the benefit of people? Or
COVID's just really done a number, I think, to everybody. Pretty much everybody.
Yeah.
Anyone I know who works in mental health is extremely busy for the last year and a half.
Yeah.
And it's just brought up so much
Yeah.
talk about uncertainty, right? It's brought up
Yeah.
so much uncertainty. We can't plan for things. We can't control things.
Yeah.
Particularly at the beginning of COVID, when all the clinics shut down for a few months, that was rough
Right.
for a
Yeah.
lot of people.
Yeah.
Um,
IVF clinics. Yep. Yep.
yes, IVF clinics and surgeries too. So people waiting for, say, an endometriosis surgery
Yeah,
so that they can do IVF, and
right.
all of those delays increased anxiety.
Yeah. Anxiety.
Yeah, absolutely. And also it's brought up so many family dynamics where, who's being COVID safe and who is not, and how do I talk to people about wearing a mask, and how do I, tell my family I'm not going to hang out with them if they're not vaccinated, and then also for surrogacy, some surrogates are not wanting a vaccine, but the intended parents do, or vice versa.
And if I'm getting pregnant, should I get a vaccine? There's a lot of uncertainty without DART research and stuff. Yeah.
There's just so much that it's brought up, all of that rooted in uncertainty. And when uncertainty is there, anxiety is there. So okay. Shifting gears super quick. There must be some positives that have come out of it too, because people have shifted focus to, hey, maybe I do want baby and it's time, or because family matters more than anything, or like, is there any overarching? You've probably seen that too. There's people saying there's going to be a baby boom. I've certainly seen, not only am I busier because of COVID related anxiety, life related stuff, but certainly more people are trying for a baby. And there's even, like, I was at a virtual fertility conference a few months ago where some of the clinics noted a 17% increase. I think that's what they said, 17% in the number of patients going through IVF. So that's pretty big, I think.
Yeah, I would say that in our clinic as well, probably. Yeah.
Okay. Yeah. I would say that too for me.
Yeah.
Which I guess, is a result of just figuring out what's important in life. And on the downside there, though, I've also seen more women struggling during pregnancy and postpartum.
Oh, because of isolation, maybe, or?
Yeah.
Yeah, of course, that would be.
It's hard to get the support you need with a newborn when
grandma can't come, or who knows why, right?
Mm-hmm.
Yeah,
exactly. People with parents who live in other countries that can't visit.
Well, for a while, dads, or sorry, if there is a father in the picture, couldn't be in with the delivery. Is that?
Yeah, at the very beginning. I think they changed that pretty quickly, but for the delivery, it seems to be okay. But for a lot of the other appointments,
on their own,
still
ultrasounds, all kinds of things, IVF appointments.
Some of them.
That's hard.
It's very hard, and so it's also changed surrogacy. So women wanting to be surrogates, it's not necessarily the best time. A lot of them are saying,
right.
But hopefully that's starting to change now.
Yeah. I see some promising. I don't know. Let's not get too deep into it, but promising that maybe all the vaccines are still, effective against these variants. But okay. So I again, cognizant of time, I wanted to just quickly touch on. I know you've spent a lot of time with the pelvic pain clinic, but also I know PMDD, premenstrual distress disorder. I think I've got that right, but
dysphoric disorder.
Yeah.
Close.
The depth of pain, whether it's emotional or physical, with both of those can really have a big impact on relationships and trying to conceive. And you see those things as well, like PMDD being more, maybe you can explain, it's just more of a profound, expression of premenstrual symptoms.
Yeah, it's like PMS supercharged. There's a definite pattern to it where it usually starts like the moment of ovulation and then all through the luteal phase. And period comes, day or two later, things perk up again. And
Yeah.
so it's that cyclical.
The darkness, a lot of women I hear, it's a dark time. Yeah, it can be real tough.
Yeah, for sure.
So you're not alone. This is so not talked about enough. I think the PMD.
Right.
Yeah.
I agree. In fact, a lot of people don't know that, there's even
PMS. Yeah. Or that PMS is legitimate, like I think there's some people out there still that think that's like wives' tales or something. I'm like, nope.
There's a lot of us out here to tell you it's real.
Exactly. Yeah, exactly.
And then also for pelvic pain and endometriosis, a lot of people don't realize it's a real thing. It's a condition or several conditions. And that there are some things that, can be done to help. And so a lot of times people just suffer silently because they don't realize that there's help. Yeah.
That there's help and that it's, but just the difficulty with conceiving, how that ties in, some people, some women literally, cannot have their sensation or touch anywhere near their labia. Like it can be very difficult to conceive when that's the case, right?
Yeah, it's a conundrum because then it makes it difficult to have intercourse to get pregnant, and it makes it difficult to go through vaginal ultrasounds and egg retrieval with fertility treatment.
Even IUI, right?
But there are things that can help, like for sure from the medical point of view, but also from my point of view, there's strategies that can help turn down that dial of pain.
Right.
And
well, first knowing where ovulation is, from my experience, like, if there's one time maybe throughout the cycle that things might be a little bit easier, on these women, it might be around there, and utilizing techniques that you've got, and we've seen some good effect with acupuncture and trying to bring down inflammation in various ways. It's a multifaceted approach, right?
Yeah, because with pain, it all starts with the nervous system and brain, and anything that can calm the nervous system is gonna also help with pain and anxiety as an aside. But that's where you come in, because I know a lot of what you do can help calm the nervous system.
Yeah. Well, wow. Okay, so we've been through infertility in general, pregnancy loss, IVF, PMS, pelvic pain, PMDD, third-party reproduction. I think COVID, the mental health. I think we've kind of almost touched on everything. I've got one last thing that I wanted to ask about, and it would be, trauma would be in there, but and there's an emerging science with the use of psychedelics, but in this, you can kind of decline if you choose or not. But I mean, do you foresee any use of psychedelics in helping women go through, or men, or go through this process in the future? Is there anything on the research horizon in psychological health? Or
well, the psychedelics are not my area, but I've certainly read about them, and I think they became well known, like the recent documentary from Oprah and Prince Harry. I don't know if you saw that.
I think Chantel was watching it.
Yeah, the Me You Can't See. They had a whole part of that exactly on that topic. And so I think it's
what happened to you than what's wrong. Yeah. I love these shifts. Yeah. Mm-hmm.
Exactly. And that's just reframing it. And so I know there is some research coming, whether it's going to be mainstream, particularly in Canada, where we have a lot of checks and balances, and it tends to take longer for anything to kind of go. But if it does, that would be in the scope of psychiatrists who prescribe medications. But it'll be interesting to see where that goes.
Because a lot of these traumas and stuff, if even struggling through fertility challenges can become its own trauma, so I would expect, I mean, I'm an advocate. I'm the guy coming from the plant medicine traditional, side of things. So I'm enjoying the resurgence of this field and the way it's being approached, even if it is a little bit clinical and pharmaceutical. I'm liking, because in mental health, at least psychiatry, the medication, that's been around for the last 20 years hasn't really moved the needle on helping a lot, so it's nice that something else is coming in. And I just am like, oh, well, that could apply to so many, clients that I've got and that you have, I'm sure too.
Yeah.
Anyway,
it'll be interesting to see where the research in that goes.
Yeah.
There's
capable people doing it at every, major institution, educational institution, in the world now. It's great. So I love that, but, or primarily in the US, I guess so far, but.
And I think, just from a therapy point of view, what that kind of allows people to do is take a step back from re-experiencing their trauma so that they can process it cognitively without feeling it in their, necessarily emotionally and in their body, and it allows them to reframe things. But there's other ways to do that too with different types of trauma therapy.
Well, from my understanding, a lot of it isn't, like MDMA or ketamine. These sometimes they're, it's not about you not playing the role in the CBT or the therapy that you use not playing a role. It's just that it seems to be able to help people go through that process easier and quicker, maybe. Is what I'm seeing. So that's I mean, the best of both worlds,
Yeah, because that's the goal with trauma therapy, is not to feel flooded by re-experiencing it, so that you can process it without actually being re-traumatized.
Fantastic. Well, I'm going to wrap up, Holly, just respecting time, and I've got to get rolling here too. But
yes, it's gone really fast. So
yeah, there's so much to you and I could chat forever. But I what I'm pulling from this, largely new foundational, idea for me is that at the root of most people going through any of these things we've been talking about is a grief process. And familiarizing yourself with that, would probably be, smart in some ways. But my wife, Chantel, who she, when we first got together, she taught me more about grief than I ever knew, because she lost her brother when she was in her early 20s, and he was just a couple of years older. And so she taught me about grief, firsthand experience of grief. And, the overarching theme is that, you get through it. You can't sidestep it or dance around it. You've got to go through it, and you come out, the other side. It becomes a piece of you, and having people like you to help go through, because how scary is that, to actually be like a buffalo and charge toward the storm is not instinctual. But eventually you never get over it, but you get through it, and it becomes a part of you that you can manage, better and better. And people like Holly can help you with that, with all of these things, because how you're feeling is legitimate. And, being compassionate with yourself and allowing yourself to get some help through challenging times, like, struggling to start your family or to expand it or have a baby is important. So, I refer to Holly all the time, and I'm just doing the same. And I'm so glad that you could come on and chat and give an overview, because you literally talk all the time about things that people don't talk about openly. So it needs to be out there. The irony of that is not lost on me. So
Yeah.
thank you, Holly.
Well, thank you for having me. It's been great chatting.
That's awesome. That's awesome. We will be. So if people are looking for you, they find you on social things or websites, you want to just, give a couple of those?
Yes. I have a new website with a new name. It's called reprohealthfertility.com.
Yeah. Awesome.
And if they go on there, they can see, I have a blog that I probably should add to once in a while. But also the link for following me on Twitter is on there.
Oh, good. Yeah. Awesome. Excellent. Well, Holly, thanks again. And I will let you go. And I'm excited for everyone to listen to this. If you've got any questions, contact Holly, or of course me. drspencepentland.com is my website, and we can chat more. We're here to help, and we're glad if you stuck around till now, good for you. Hopefully you got some great pearls from today, and hope you have a great rest of your day.
You too.
Thanks, Holly.
Bye.